Hello everybody, my name is Patrick Flores and today I will be discussing sepsis and septic shock and how they affect the immunity system. Immunity protects our body from injury and infection through several defense mechanisms. The body's immune system protects us against foreign bodies and cells. This defense mechanism responds by production of antibodies and the inflammatory response of the body. Mast cells activate the inflammatory response, and the inflammatory response rapidly occurs after cellular injury. First lines of defense include the skin, the mucous membrane of the GI, the respiratory tract and its mucus, the gastric acid and vomitus, saliva and respiration, and the urinary tract. Antigens are foreign to the body. Infectious antigens include viruses, bacteria, fungi, and parasites. Non-infectious antigens include food, drugs, vaccines, blood during transfusions, pollen, and transplanted organs. Once the body has been invaded by an antigen, the body recognizes them as foreign. Physiological and biochemical immunity starts. The immune response produces antibodies. The B cells secrete antibodies that are specific to and attached to the antigen. The T cells attack the antigen. Antibodies attack the antigen to help prevent infection. The immune system removes damaged cells through the process of phagocytosis, and then the body begins to maintain homeostasis. Types of T cells. Cytotoxic T cells can release toxic substances to the antigen or viral cell in the body. Delayed hypersensitive T cell release macrophages and enzymes that cause tissue damage. And memory T cells can prevent an antigen from developing in the body by using antibodies that were previously produced. Memory cells are produced when B cells and T cells are exposed to an antigen. Some of those cells become memory T cells. Individuals with impaired immune responses, such as chronically ill patients and elderly patients, continue with infection and require treatment. If not treated, sepsis can occur. Sepsis is a potentially life-threatening complication of infection. Response is manifested by an increase in temperature, heart rate, respiration rate, and white blood cell count. Early treatment, usually with antibiotics and large amounts of IV fluid, to improve chances of survival. Sepsis can progress to severe sepsis if blood pressure is low and patient is showing symptoms like a decrease in urine output, mental status change, difficulty in breathing, and an abnormal heart function. As sepsis worsens, the blood pressure remains low and no response to the fluid replacement. Impaired blood flow to the vital organs such as heart, kidney, and lungs will lead to organs that will not receive enough oxygen and nutrients, which leads to impaired tissue perfusion and impaired cellular metabolism, which results in septic shock. Septic shock can be treated through aggressive fluid resuscitation, immediate treatment of antibiotics intravenously. Initially, multiple antibiotics are given, vasopressors if blood pressure remains too low. Depending on condition, breathing machines may help as well. Sometimes dialysis is needed for kidney failure. Continuous monitoring of vital signs, blood tests as needed, and clinical tests such as X-rays, MRIs, ultrasounds, and EKGs will help as well.